Hello guys, it is medical information, and in this session I want to speak about Williams exercise for low back pain. Previously I have spoken about low back pain, its etiology and treatment, but the exercise in the chronic phase remained for this session. The Williams exercise is recommended after alleviating the acute low back pain, and it is aimed to decrease lumbar lordosis or the concavity, to decrease the compression on the spinal nerve roots. You can see that Williams exercise consists of several modalities, and for example in this one the patient must lie down on his back or her back in supine position, and the patient must bend the knees, and then the patient must push the abdomen to the ground. It is aimed to decrease the lumbar lordosis and improve the muscle contraction in the abdominal muscle. And in this one, the patient in the previous position must contract her abdominal muscle, and the patient must try to get up from the ground and bend the upper trunk. In this position, the patient must bend the knee, fully bend the knee, and the knee must be close to the abdomen. And in this position, the patient must bend both knees, and in this position the patient tries to touch the toes by the fingers. There are also other modalities. For example, the patient in this position tries to pull the knees into the abdomen by the arm, and the abdominal muscle are also contracted, and in this position the patient is again trying to touch the toes. The Williams exercise are recommended in the chronic phase, and they must be performed 3 times a day. It is not needed to perform all of these exercises, but the patient can choose, for example, 2 or 3 of them, and the exercise must be repeated 3 times a day, and each time the exercise must be done for 8 consecutive times, each one lasting for at least 10 seconds. In addition to Williams exercise, there are some tips that the patient must consider in daily life. For example, when lifting something from the ground, the patient must use the knees instead of the spine. In the right side you can see a man who is lifting the box with his knees, and the spinal column remains straight. But in the left side, the man uses his spinal column, and he has bent his spine, and it can increase the pressure on the spinal cord and can cause low back pain or exacerbate the pre-existing pain. When lying down on the ground, it is recommended to put some cushions beneath the calf, because it can decrease the lumbar lordosis and subsequently decreasing low back pain. Also, when the patient is standing still, it is recommended to put something beneath one leg. It can also decrease the lumbar lordosis, and it will be helpful to decrease the pain. As you can see, all of these exercises are aimed to decrease the lumbar lordosis and to improve abdominal muscle tonicity to decrease the pain. If you enjoyed this video, please don't forget like, comment and subscribe. See you soon.